Hi. I'm going to answer a simple question with kind of a complicated answer. Or I don't know. You tell me. We'll see if it was complicated or not. And the question is, how do I replace a missing tooth? If you're missing a tooth in front or you're missing one of your back teeth, a very common question is, now how do I replace that? And if it's your front tooth, it's obviously a cosmetic concern. And if it's your back tooth, it may or may not be a cosmetic concern for you. So an obvious answer choice is do nothing. If it's not a cosmetic concern, you may wonder, why do anything at all? So let me answer that first. Our teeth support one another in their position. So if you are missing a tooth, whether it's a front tooth or a back tooth, it will cause that whole area, that whole side to change. The upper or bottom teeth that are opposite it will often start to move down or super erupt, move up if they don't have a tooth to hit against. And the teeth on either side will tend to space a little bit. You may have real tight, healthy contacts between your teeth. You can floss and brush between them. But if you're missing one tooth smack in the middle of all your other teeth, like fence posts that are all up against one another, if you're missing one of them, and those contacts start to loosen up a little bit between your other teeth, you may start getting more food caught there and have noticed yourself flossing more often after meals and things like that. So there are reasons to replace teeth that aren't just cosmetic. Even back teeth, of course, chewing surface and making sure that you have enough teeth to be able to chew with, etc. So that being understood, there are reasons to replace our teeth. Now the question is, how do we replace them? So whether it's a back tooth or a front tooth, there's three main ways to replace a tooth. One, you do something removable. It's usually called a partial denture. Denture is something that replaces all your teeth, and if you're just going to replace one or another tooth, we call it a partial denture. So if you do something removable, that's a great choice. I do removable partial dentures all the time. Of course, you have to take them in and out, which is a big negative. A big positive is that they're very affordable, and they can replace more than one tooth, and sometimes solve several issues. They help hold your teeth together and support them, prevent your teeth from shifting and moving like we talked about. They restore that surface area for you to chew from. If you're missing a back tooth and you're not using that side and you get a partial denture, now you can start using that side again, so you're not chewing in front as often. So there are some real benefits to it. A big negative, of course, comes in and out, and you have to clean the teeth around it. You have to make sure you maintain it. You can do something fixed, meaning cemented in. We would have to use two of your adjacent teeth, or at least one of your adjacent teeth, to cement something in. You can't cement something on the gums where you're missing a tooth. We have to use your two other teeth for support. The big benefit there is it doesn't come in and out. And for a lot of people, that's a huge benefit. That's what they don't want, is something that comes in and out. So it's a great option. A big negative is that your routine in maintaining your teeth, your brushing and flossing at night, has to involve an extra step of cleaning around that false tooth. Because if you can imagine, it's just a floating tooth attached to another tooth, and often you can't even floss between it the same way. So there are extra steps involved with cleaning that. And if you slack in that and you don't do it, you start to develop that plaque and tartar around that tooth, and you're going to see the negative effects: odor, decay, etc. You can't get a fixed bridge and forget about it. You have to maintain it properly. Another big negative is if your other teeth on either side were completely healthy and didn't have even a filling or a cavity or anything to them, we will have to irreversibly change them in some cases to be able to attach a supporting tooth to it. The third choice is an implant, and an implant is a great option. It satisfies a lot of the negatives that we spoke about earlier with the other options. Of course, it gives you back your chewing surface. Cosmetically, it'll give you back a tooth. It'll prevent other tooth from shifting. So there's all those benefits. It's also fixed. It doesn't come in and out. That's a huge benefit. You can brush and floss it like normal. You don't have to add in that extra step that we spoke about with flossing under a floating tooth. So it has a big benefit there also. The negatives, its cost is different than the other two options, and it's more time consuming. When an implant is placed, you have to wait a few months for that implant to integrate with the bone, to kind of fuse with the bone and become like the roots of your other teeth before we can go on to the second step. So I don't know if those are negatives for everybody, but these are some things to consider. All of those options are great options, and almost every dentist does all of them routinely. There are specific reasons why in your case one may be better than another, and I invite you to come in and see me if you're in the area, or if you can come in or see a dentist you trust in your area and discuss which of those options work for you. So maybe this wasn't as complicated as I thought, because it kind of came out pretty straightforward. Anyway, if you have questions, put them in the comments. I hope this made sense. Take care.